Basic examination techniques. Most of the patients coming to a general practitioner are suffering from minor symptoms and do not require a detailed systemic examination. Yet, you should make a habit of doing a quick general examination of the patient and look for certain basic things. From the facial expression of the patient, from the way the patient walks in, you should be able to make out whether he is ill or generally well. As the patient lies down, palpate the pulse, touch the neck and the forehead and see if there is fever. Ask the patient to put out the tongue. Look at the conjunctiva and sclera for pallor and jaundice. Palpate the neck for lymph nodes. Look at the legs for edema. Then flex the patient's legs and palpate the abdomen for liver, spleen and any other lump. If the patient has abdominal pain, palpate carefully to note the area or point of tenderness. Then auscultate the heart sounds over the precordium. Ask the patient to breathe deeply through open mouth and auscultate the respiratory sounds, especially at the apex and at the base. If the patient is elderly, obese, diabetic or hypertensive, check the blood pressure. By this way, a complete examination can be done within a minute or so and practically while you are eliciting the history. If the patient complains of jaundice, inspect the sclera for yellow discoloration. Then see the tongue because extreme pallor is sometimes mistaken by the patients for jaundice. Then palpate the abdomen for hepatomegaly, splenomegaly and ascites. A soft, tender liver is seen in infective hepatitis. Splenomegaly and ascites are seen in cirrhosis with portal hypertension. If the jaundice is mild or suspicious, take the patient close to a window and see the sclera in bright sunlight to see the degree of jaundice. Because mild jaundice cannot be appreciated in artificial light. If the patient is very pale, the tongue, conjunctiva, the nails and the palms will be very pale. Look for puffiness of the face and edema of the legs. Palpate the neck for lymph nodes and palpate the abdomen for liver and spleen. If there is hepatomegaly or splenomegaly, then detailed blood investigations will be required. Auscultate the chest. A systolic flow murmur is often found in moderate to severe anemias. And you should also look for signs of vitamin deficiency in pale children. If the patient has abdominal pain, palpate carefully to locate the area of tenderness. Where possible, try to locate the point of maximum tenderness. The point of maximum tenderness is usually the guide to the organ affected. Look for any lump, palpable liver or spleen. If the patient is alcoholic, look at the sclera for jaundice. Look at the tongue for pallor. Then palpate the abdomen for liver, spleen and ascites. Though advice to an alcoholic is often futile, while examining, always tell the patient about bad effects of alcohol and encourage him to abstain from it. Then make the patient sit up and look for tremors. Ask specifically about tingling numbness of the limbs suggestive of alcoholic peripheral neuritis. If the patient has fever for more than 5 days, look for pallor and jaundice. Examine the throat for tonsillitis or pharyngitis. Look for palpable lymph nodes in the neck. Then test for neck stiffness to rule out meningitis. Then flex the legs and palpate the abdomen for enlarged liver or spleen. Auscultate the chest for abnormal breath sounds. If the duration of fever is more than 5 days, the patient must be examined in details. All the systems should be carefully examined and then investigations carried out as indicated. If the patient has backache, examine the patient preferably in a sitting position, bending forwards. Palpate and thump the spine for tenderness, deformity and gibbous. Then look for paraspinal muscle spasm on either side of the spine. Then let the patient lie down supine and perform straight leg raising test by lifting one leg holding the foot. If it is positive, the patient gets backache on raising the leg, which suggests a prolapsed disc or sciatica. Then ask the patient to dorsiflex the toes against resistance to look for weakness of extensor hallucis longus, which is the earliest motor loss in spinal lesions. In this way, you should form your own routines for each symptom and examine the relevant points so that you do not miss any important sign associated with that symptom. Antenatal checkup. When a pregnant lady comes for routine antenatal checkup, first record her weight. A rapid increase in weight on serial recordings is the earliest sign of preeclampsia. Then as you examine the patient, look for pallor of the tongue and conjunctiva, look for edema over the legs, then record the blood pressure and auscultate the heart for any murmur and chest for any abnormal breath sounds. That completes the general examination. Then coming to the examination of the abdomen, first expose the abdomen and palpate the fundal height. Then use the fundal grip with one hand and with both hands to palpate the soft breech or hard ball-like head. Then with lateral grips, locate the uniform back and knob-like limbs. With first pelvic grip, locate the presenting part. And if it is a vertex presentation, use deep pelvic grip to feel the head. Then look for overlap above the symphysis pubis. And lastly, auscultate the fetal heart sounds over the position of anterior shoulder. To repeat, first palpate the fundal height, then fundal grip with one hand fundal grip with both the hands, then the lateral grip on the right, on the left, then the first pelvic grip for the presenting part, then the second pelvic grip, then look for overlap, and lastly auscultate the fetal heart sounds. If the uterus is over distended and tense, look for thrill of hydramnios.